Well, the world is more at risk of a pandemic and less safe from deadly virus outbreaks than it was before COVID. That's what a major pandemic preparedness report has found. Professor Sharon Lewin is the director of Melbourne University's Doherty Institute for Infection and Immunity, and she joins me now from Melbourne. Sharon, thank you very much for your time.
Pleasure to join you.
Just before we get stuck into this report, I just wanted to ask you about the diphtheria outbreak here in Australia. We just heard from the Federal Health Minister announcing that additional $7.2 million package. Are we doing enough to get on top of this outbreak?
Well, that extra funding is really most welcome. This is really serious. Diphtheria is an infectious disease that we thought we would never really see again. It's completely preventable by adequate vaccination. So increasing vaccination standards will make a very big difference here. So the extra funding, I think, is most welcome, something we definitely need to get on top of.
And just quickly, what do we need to do? What is necessary to be done now to contain it? Is it about vaccines, getting needles in arms, as the Federal Health Minister said, or is it more about antibiotics and treating those who have it?
Well, it's both, of course. If someone's sick and needs treatment, they absolutely need to be a high awareness about it and to see their doctor and receive treatment. It is a treatable illness with antibiotics. However, the most important thing now is also to get vaccination rates up, particularly in the Northern Territory and amongst Indigenous communities.
OK. Back to this report to the World Health Organization, where it's warning the world is more vulnerable to pandemics and deadly disease outbreaks than it was before COVID. How is this the case when we've had the learnings of COVID and we've also had advances in vaccines and diagnostics?
Well, the report's pretty alarming, actually, and I think it's a reminder that managing pandemics and infectious diseases is not just about the science. You need the science, you need good vaccines, diagnostics, therapeutics, but you need partnerships with community, you need trust in that science, you need good political leadership, and you need a way to implement the science. So I think this report tells us that scientific advances alone, as actually we saw in COVID, is not the full answer to pandemic preparedness. And we need more funding, more sustainable funding and equitable access to these tools.
So a couple of things that you mentioned there, partnerships, trust, political leadership there. How do we get better prepared when it comes to global cooperation?
Well, the report focuses particularly on global access, and that's a big issue, particularly for low and middle income countries that have fragile governments, limited funding, limited access. There's a number of initiatives to assist that. First of all, we have the WHO. It's an incredibly important global agency. We have agencies such as Gavi, which provide vaccines to low and middle income countries. And we rely on countries like Australia, countries across Europe, high-income countries to contribute to these global funding to assist low and middle-income countries. Just a reminder that pandemic preparedness, the biggest and most effective thing we can do is stop it at its source. So when you have an outbreak of Ebola in Africa, you want to have the capability to stop it right there.
In 2024, the WHO detected almost twice as many health emergencies as it did in 2015. What did the report say, if anything, about why the risk of this is increasing?
Well, it said the number and significance and cost of of outbreaks is increasing over the last 10 years, and that's multifactorial. We're seeing more outbreaks largely because of changes in our environment, such as climate change of distribution of mosquitoes, global mobility, war. All of these things will contribute to outbreaks. And I think following COVID, we've got this additional challenge about mistrust and also misinformation, which is a big part of what's driving, for example, lower rates of vaccination.
How can you re-inject trust into public institutions?
Tricky. I'm not sure I've got the solutions on that. I think consistent, transparent communication's really important. I think in Australia, the establishment of the CDC, the Centres for Disease Control, is actually a great initiative where we have a single voice that can speak to government and to the community about the latest facts around these outbreaks. It's up to government working in partnership with scientists and organisations like our own to restore that trust again.
Yeah, I'm interested. You mentioned the CDC there. We know that it's been established here since COVID. A long time coming, some would say. What has its operation and effectiveness been to date?
Well, the CDC was officially launched 1st of January this year, and they have been at the centre of, for example, this outbreak in diphtheria. They've provided guidance on our management of the recent people that were on the ship exposed to hantavirus. I think they've put out some fantastic information. So on their website, you'll see up-to-date information of these different outbreaks. And I think overall, a much more coordinated system. That's what we're experiencing now in the early days of the CDC. But I think they'll also make some real advances in how we manage and collate data across the country. We previously had it quite fragmented, being a federation, and this is an opportunity to synthesise it in a much more efficient way.
And just, Sharon, touching on Ebola, which you mentioned in one of your last answers there, just how concerned are you about that outbreak there in the DRC?
Well, sitting in Australia, I'm not concerned around this reaching our shores. We need to be prepared, of course. People travel a lot and we are prepared. We have tests available to exclude someone that might arrive here with Ebola. Australia's never had a case of Ebola in our history. Having said that, containing the source is really important. And the global health environment has really changed significantly, largely because of the US pulling out of funding the WHO. We need organisations like the WHO who assist on the ground in places like the DRC to contain an outbreak like this. So for that reason, I am a little concerned that we're in a different position now than, say, we were 2 or 3 years ago with the strength of the WHO. But they're on the ground, they're helping. There's a lot of talent and expertise in Africa, particularly in that region. They know Ebola. They've been working with many outbreaks over years. And the most important thing is that we can move resources there to contain the outbreak.
Sharon, it's always great to speak with you. Thank you very much for joining me.
Thanks so much.